This is a presentation for field aeromedical transport, and this is based on the West Virginia OEMS Protocol 9105. So what is the objective of the aeromedical transport from the field? So we're going to use aeromedical transport to enhance the survivability of a select demographic of patients, and that's going to be incorporating, for one, the speed in which a patient can be transported to an appropriate facility, and also utilization of the medical capabilities of the aircraft and aircrew. These are quotes specifically from the 9105 protocol. The first one, field access to aeromedical transport may enhance the probability of survival of a select small percentage of patients. And the second one, if the drive time to a designated level 1 or level 2 trauma center is less than 30 minutes and there's no extrication delay at the scene, aeromedical transport is rarely indicated. So this is a timeline of what it means whenever you call for an aircraft in the field. There are a lot of things that go into this process, and it's a lot more complicated than just calling your local command center and saying, hey, I want a helicopter. So I encourage you to pause the video and look down through here, just get a better understanding of what it means to call and request aeromedical transport. So you've made the decision that this patient would benefit from aeromedical transport. So how does that process happen? Well, here's what we do to request a helicopter. This all goes through our local command center, whichever region you're in, just through your normal medical command. You'll discuss that with them, and then together you'll determine if this is appropriate for this patient to be transported by aeromedical. What are the appropriate reasons to call for aeromedical transport for our patients? Well, here's a nice guide that we can go through and determine, is this the appropriate means of transport for this specific patient? And be it trauma or medical, you can refer to these in your state protocols and decide if this is the appropriate means to transport this patient. There are a lot of factors that go into being denied a flight, so don't be discouraged if you do request for aeromedical transport and this request is denied. There are a lot of factors that go into deciding if this is the right way to transport a patient. First and foremost is weather. Weather really becomes a big factor when deciding if this is an appropriate means to transport the patient. Now, there's some aviation programs in the state that have some abilities and tools to fly in less than adequate weather conditions, but that's still a big factor and needs to be taken into consideration. Now, you may look outside and think, wow, the weather's beautiful here. I don't know what the issue is. So weather determination really comes down to not only where you're located, but where the base is located that air asset's coming from, the weather on the way, and the weather at whichever receiving hospital the patient needs to go to. Something else that may be a consideration is an extended timeline for this. If there's no asset that's close to you available, this could lead to a long wait time to get this aircraft and get this patient transported. So that may be that it's best to take this patient to a near facility where they can be treated there and then transferred later via air or ground. Lastly, one of the things that we want to consider is the condition of the patient appropriate for aeromedical transport. Now, this could be that the patient is very unstable, and maybe it's better that we take the patient to a near facility where they can be stabilized. Or, after discussing this with medical command, maybe this patient doesn't really meet the appropriate criteria for transport via aeromedical. Something else to consider is the environmental criteria. So in West Virginia, this has a lot of very rural areas that's very difficult to get an ambulance or even a UTV out to the patient. So this could be appropriate to discuss that with medical command, that maybe an aircraft would be a proper means to get the patient out of that area. Also, something else is under a mass casualty incident where local EMS is really overwhelmed. Aeromedical could provide some additional resources, transports, and also some additional crew members to come in and assist with those MCIs. Now, what are the procedures for actually requesting a helicopter? As we discussed earlier, this is going to be done through our local medical command, whichever region you're in. When you call them, you're going to provide very detailed information, not only on the patient, but in the situation as well, what's occurred, and also the LZ information. So if you have the GPS coordinates, or if this is going to be handled by a fire department, who they'll be talking to, the frequencies that they'll be using, etc. When you call and request an aircraft, there are two different types of requests you can make. The initial response would be, I see this patient, I've assessed them, and I need them to launch and respond to the scene. On the other hand, it could be just a simple standby. So when you call and ask for an aircraft to be placed on standby, this may be the case that you're responding to the scene, you're not sure yet, you've just arrived, you haven't got a good assessment, but you believe this might be a likely possibility that you'll need aeromedical transport for this patient. In those instances, same process, we contact medical command, they alert the nearest asset, that asset will respond to the aircraft, they've done a weather check, and this just means that if you do request for a launch or a specific response to the scene, then that process has already happened and things can move a little quicker. Now, once you've requested Aeromedical, we want to stay in contact with medical command. A lot of things are occurring and they may need more information, so it is really important that you stay in touch or at least be available for communication with the local medical command center. Now, just a little bit of information on preparing a landing zone. Oftentimes this isn't done by the requesting ambulance or crew, but by the fire department. But it's good to have this knowledge and know what type of LZ we need to prepare or have ready if you do request for aeromedical transport. So we need to have 100 by 100 foot area, and oftentimes we don't think about a helicopter needing takeoff and landing routes, but this really becomes a big factor because helicopters, while they do take off and land from one spot, it is important to have a way in and a way out just due to the flight physiology of how helicopters work. Now, it's also important to keep bystanders and also personnel at least 100 feet away. Anybody who's ever been around when a helicopter lands knows that there's a potential for a lot of debris to fly around, and also we want to keep them out of the area of the helicopter just so nobody gets hurt. So if it's at night, this is good to use blue flashing lights or green lights or amber lights. Something to consider, and this may be if you're not sure what type of lighting to use, you can coordinate that with your local aeromedical agency so it's a light that they're able to see while using night vision goggles. Light sticks are great to use too. It's just important to remember not to use flares. As we said, things can fly around when a helicopter lands, and we certainly don't want to send a flare flying into the woods, creating more issues for us. Now, I've really stressed communication during this whole process, and obviously that's very important. So we're going to hit on communications specifically. When you call for an aircraft, there needs to be one specific person who is operating a radio and is on the frequency that you have coordinated with medical command and prepared to give a good LZ brief when the aircraft gets into the area. So once you've made that determination who's going to do that, they need to have the radio ready and be listening and watching for the aircraft when it's on approach. So this needs to be something that you don't just walk away from once you've made contact with the aircraft. You've established comms, you've given them a good report of what to expect with the LZ, give them an idea of what type of obstacles are in the area, are there any wires that they need to watch for, and understand that wires are very difficult to see from a helicopter from above. From that perspective, there's really not a good way to see lines and wires in the area and even towers, and that becomes exponentially worse at night. So once you've made that contact and given them a good idea of what to expect, then it's really important to maintain that communication, stay on that radio frequency, and if anything comes up that you need to alert them about, that you're able to do so very promptly. This is a topic that gets brought up pretty regularly. Can we use a hospital LZ as an LZ for a field transport? And the answer is yes, we certainly can. These are usually set up a paved area with lighting around them, so that is something that we certainly can utilize. It just needs to be coordinated with the hospital, and this is best done prior to the need for utilizing that LZ. We want to work out an MOU with that facility just to make sure everybody's in understanding of, hey, we might be using this for a field transport, and just to have that coordinated prior to. And you want to make sure you've got permission to use their site. In conclusion, the use of aeromedical transport for patients is a very powerful tool, and this is something that needs to really be assessed to make sure that we're utilizing this resource in an appropriate manner, and also that the proper communications and adherence to those protocols are utilized appropriately. So I appreciate you guys watching this, and hopefully gives you a little bit better insight on the field request for aeromedical transport.